Ewing sarcoma is a devastating form of bone cancer that is the second most common pediatric bone cancer and is known for its aggressiveness. 25% of incident cases of Ewing's present with metastases. In turn, patients with metastatic cases have a 5-year survival rate of less than 30%. Ewing's is a disease that has deeply affected the course of my life. In April 2012, my then 14-year-old younger brother Daniel was diagnosed with metastatic Ewing sarcoma. He underwent 10 months of treatment, including 17 cycles of chemotherapy, before he thankfully entered remission in February 2013.
With my brother in mind, I'm proposing a case control study investigating the possible association between high added sugar levels and Ewing's, with the linkage being the insulin-like growth factor 1 pathway.
The connection would work as follows. A high blood glucose level would augment the amount of circulating insulin in the body, which would result in greater stimulation of the IGF-1 synthesis mechanism. In turn, the IGF-1 receptor has long been linked with Ewing's as an oncogenic EWS-based fusion protein. A protein that is present in 98% of Ewing's cases has been shown to increase IGF-1 signaling, since teenagers, who are the age group most commonly affected by Ewing's, on average consume more than 4 times the recommended daily amount of added sugar. They would be particularly susceptible to the effects of this biological mechanism.
This case control study will examine 160 newly diagnosed Ewing sarcoma patients aged 13 through 19 and 320 teenage controls. The Ewing's patients will be drawn upon from the member institutions of the Children's Oncology Group. The controls will be individuals who do not present with ES. These controls will be recruited during periodic primary care evaluations at these same COG institutions. The controls will be matched with members of the case group on age within 2 years, body mass index within 3 BMI units, ethnicity, and gender. This case control study will consist of 2 tests to assess simple sugar consumption. Firstly, glycated hemoglobin levels will be measured once in the case and control groups. Secondly, simple sugar consumption will also be evaluated through 2 24-hour online dietary recalls that are 2 weeks apart. All 480 patients will be asked regarding the food and drink that they have consumed over the last day. An average score, calculated from the total sugar consumption in each survey, will be assigned to each patient. Finally, IGF pathway activity in the 480 teens will be assessed using an ELISA assay for IGF-1 levels in blood serum. For each test individually, a blind statistician will stratify the patients into 3 groups, and the frequency of ES will be documented in each of these groups. The agreement between the IGF ELISA assay, the glycated hemoglobin test, and dietary surveys will be examined. Separate odds ratio calculations for each test will be made and subsequently compared to each other. A 95% confidence interval will also be determined for each OR. The study will seek an odds ratio of 2.1 or greater. We expect this case control study to take a total of 2 years. This NCCS grant will be able to cover all the expenses related to this case control study. In short, an NCCS grant would allow us to act proactively to identify a potential risk factor for Ewing's while saving children across the world from this terrible disease. Please help us help children by supporting this invaluable Ewing's research.